that your patient cannot really go into pronation, so bring your hand off this for a second, and they're angled like this when they try and go into full pronation. They can't do a tripod pinch, so try a tripod pinch, which would be like that if we did a pinch test, and they have to bring their arm out to the side to do that, then that would tell you their olecranon needs to be medial, have a medial glide. So we're going to glide that olecranon in, so you can always hold that with the hand. So you can come right here to him. So turn to your side, Rishi. Good. So you can take your hand and test that by holding that on the edge of the olecranon and shifting it medially, and see if that helps them turn more. And you can feel if the muscle activates. Or the alternative choice is to take their arm out to about 20 degrees extension, shift it posteriorly back into the joint space, and then come back again. So that usually will help, because this olecranon will sit like this. They've rested their arm like that. So the anconeus will pull the olecranon a little bit over that way, and then their forearm is not really sitting right. If you looked at from this angle, he's actually in a good spot. He works out all the time, he's not injured. But if you were looking at the back of someone's arm, and there's this olecranon was way out down here because they've walked around with their elbow flexed a lot, you'd end up coming back there, and that would be reapproximating the elbow into the right position. So if they have trouble with supination and pronation, you'll probably look at the back and see there'll be an indent here, and what you need to do is get that back there, and when they come back down in this position, they should have better supination, pronation. And sometimes you have to do it, I don't want to have my arm in the way, like this, and shift that at the same time. I'm not in a good angle, so shift that at the same time as that posterior glide, and then they'll move easier in that joint space. Yeah? So the way to exercise that is this. So take that band. So if he was winging out a lot, and he really had a struggle trying to get his elbows to bend up, so come up for me. What we need this to do is come medially, so we can take this band and put it on the forearm, okay, and band on the other forearm. And I have a picture of a lady that did this. I just never broke it down to tell anybody. All right, so arms kind of come away right to the sides perfectly, and then you go up and down, and that'll keep them medially. So if you have an ulnar nerve patient, somebody that has a big valgus kind of positioning of their arm, get them to either hold the band with their other hand while they do like a weight or something, or you get them to put these bands, and these are CLX bands around that. All right? So if we were to ask him to do this just with one hand, good. So we could also ask him if he wanted to do exercises up and down, then he has to keep that medial glide, so go up and down with this elbow. Yep. So on medial collateral people in golfer's elbow, this is a really good exercise for them, because you want to stay close in. You don't want them to be coming out at all. They really, your goal is to keep them there, and they're in this position where they don't come out at all. They stay close, so you can close in that collateral ligament. And one of the favorite exercises is if they were in this position, keeping that medial glide and coming up. So that would work brachialis. That would turn on this muscle and help restore some elbow balance. Okay? You can do any combination of those things, but if it's painful, then try that medial glide. Right? That's got